Some people like to go for a walk in a park or in a forest. I like to meander through the aisles of the pharmacy and the health food store to see what I can pick up. Well, there's some particular aisles I like. Those are the ones that have the natural health products. That's what we have here. And there are thousands and thousands of these products out there. And of course, you would think that they're in a pharmacy, especially if they have an NPN, a natural product number on it, as bestowed by Health Canada, that these have been proven to be safe and effective. Well, that isn't exactly so. They fall into two categories. There are the ones that are the so-called traditional remedies. And for that, you really don't need anything except to show that it's been around for a couple of generations. Antiquity is all that they look for. They don't look for efficacy. Nah, never mind. If it's been around long enough, you can sell it. Then there are the non-traditional remedies. And for those, they do require some modicum of evidence, but it can be some reference to a textbook, it can be a mix of anecdotes, or it can be some sort of clinical study, nothing like what is required for prescription drugs. And that's why you tend to find all kinds of stuff out there, even without natural product numbers, because the industry is so loosely regulated. For example, as I was meandering through there, pick up this thing. It's called Taurus Forte for male peak performance. It doesn't even have an NPN number, so it probably isn't even legal to sell it. What does it have? Oh, it's got some oat extract, because I guess this is what you're supposed to do if you plan on sowing some wild oats. It's got some testicle extract, it's got ginseng, it's got lipoic acid. Any supplement that you've ever heard of is in here. Now, obviously, because there's some 30 ingredients in here, each of them is going to be there in very, very small amount. The only thing that this doesn't have is any evidence. So no, there are no scientific studies to show that this has anything to do with male peak performance, but you can go into a health food store and just buy it. So I think that you're taking a risk if you're relying on these things to have the same kind of evidence as pharmaceutical products. They don't. Most of them, of course, will not likely cause any harm, but the question always to ask, where is the evidence? And that's a question that we should be asking Health Canada, because they're not really asking the manufacturers for very much evidence.